Hi friends, today I want to talk to you about the best exercises for the hip and femoral neck. Hi, I'm Dr. Lisa. I'm a physical therapist and a specialist in osteoporosis and bone health exercise. And having low bone density in your hip means you have a risk factor for a fracture. So not only am I talking about exercises to improve bone density, but we're going to talk about the evidence-based exercises that can help reduce your risk for fracture. Now we know that for women over age 50, 1 out of every 2 will experience an osteoporosis-related fracture in their lifetime. And women get 75 to 80% of all hip fractures. And the sad truth is, for some, a hip fracture can really be a life-altering event. So these are the exercises that I do for myself as a person with low bone density and that I share with my clients. So we're going to address a few different things here. We want to address strength. So we want to improve the strength of the lower body and the hip so that we can respond to a potential loss of balance better. We want to do strength exercises that create the right tension and force around the hip to encourage the hip bone to grow stronger. And thirdly, we want to do balance and stability exercises that move us in the directions that can help protect us from having a fall and a fracture. Here's why. We know that most hip fractures occur because of a fall to the side onto the hip. It's typically a fall to the side or backwards, landing on the hip here, right where that pointy bone is. That is how a fracture occurs. So if we work on exercises that improve that side-to-side stability, we can help prevent a fracture. And then the last component that we'll talk about is impact, because we know that impact can be a powerful stimulus to bone to encourage bone to grow. That is for those where impact exercise is appropriate, and it's not appropriate for all. So I'll show you the demonstrations, but I strongly advise you to work with a professional in bone health exercise to make sure impact exercise is right for you. All right, let's go through. The first exercise that I do and that I encourage my clients to do is a squat. And I will do a front squat. That means the weight is on the front. That is keeping my chest lifting up. And I squat to a chair or a box, keeping the knees tracking over the feet, keeping the heart up nice and tall, using the weight so that I challenge my muscles to work harder. And this is in the category of weight-bearing exercise. So there's a load on my skeleton, there's load on my body versus an exercise that you do sitting. Maybe you're sitting in a machine and you're lifting your leg. That would be a non-weight-bearing exercise. So we want exercise that is weight-bearing or in a closed kinetic chain so that we get the right stimulus to the hip. So exercise number 1 is squat. Exercise number 2 is lunge. So a lunge can be a forward lunge. It can be a backwards lunge. You can go all the way down, or you can go part way down. That's okay. We have options there. And then here's the one that I love, which a lot of people don't do, and that's the lateral lunge. And when we talked about that side-to-side stability for preventing falls to the side, doing movements that have us move laterally are really important. So a lateral lunge is included as targeting the hip and providing more lateral stability. So lunges in all directions are beneficial. That's exercise number 2. Exercise number 3 would be a step up. Again, a closed chain or weight-bearing exercise, and especially important because it's one leg at a time. So as I step up, the muscles here are all working and contracting and pulling on the bone in my femur and hip. So step ups forward, you can do with weight also. So we're just categorizing step ups, but also adding lateral again. Lateral step ups are going to provide a slightly different stimulus to strengthen the hip and provide that lateral stability we want to prevent a fall to the side. That was number 3. Number 4 is a deadlift or a hip hinge. So deadlift Hips reach back, spine stays long and straight, and we come back up. A deadlift targets the muscles in the glutes and the hamstrings and the lower back, muscles that are attaching on the femur. Deadlift is exercise number 4 that I do to make sure I'm targeting the hips. Exercise number 5 is a suitcase march. Standing, holding a weight in one side, arm out here, this is my counterbalance. I want to make sure that my trunk stays nice and stable, and now I do a slow march with the weight in my hand. Now here I'm balancing on one leg. I have a weight that's trying to pull me over, and that hip has to work to stabilize me. When I put the other leg down, the weight's challenging that hip in a slightly different direction. So a lot of activity, a lot of stabilization and contraction happening at the hip as we do these slow marches with a weight in our hand. I would do a set with a weight in one side, and then another set with a weight in the other side. And I know you're asking me, how many? Well, what I want to tell you is I incorporate all of these different movements in my exercise programs. So if you look at any of my playlists, my moderate intensity playlist or my beginner's playlist, there's always going to be exercises that are like this that are in there because I want to make sure we're covering all our bases with our hips. Number 6 exercise is lateral stepping over an obstacle. This is our dynamic balance exercise and also lateral stability exercise. Again, for that fall prevention component on top of the strengthening component. So we look at exercise for osteoporosis, osteopenia, for bone health. It should be multimodal. It should include balance exercise, stability, posture, strength, and for those who are able, power and impact. And impact is the last component of what I'm going to introduce here for the hip. So we do know that it can provide a really strong stimulus to tell bone to grow stronger. But you need to have a very good base of strength before you do impact. And we need to know that there aren't any other precautions on why you should avoid impact exercise. So you can watch these exercises and check with your PT or osteoporosis expert to see if they're right for you. So first one is a stomp. Now we know with a good stomp, even if shoes are off even more, we can provide a lot of stimulus to that hip bone. So a stomp is an impact exercise that can be done. So is a jump. I like to do a lateral hop onto one side. You can let the feet come together or try to stick the landing. So that provides a powerful lateral movement as well as an impact as we land on one leg. And then lastly, squat jump. Sitting back, doing a jump and a landing. Again, that is not a starting point, but for people who have prepared their body, doing the right plyometric preparation, so your feet, ankles, knees, hips, and back are all ready to begin impact exercise. Again, this is a sample of the type of exercises that can be beneficial for the hip. I include them in all the programs I do, whether they're on my website, my 4x4 exercises, and my build program. That's for experienced exercisers only. But also in my level 1 beginners program, which you can get on the wait list for that, I run you through exactly all the right exercises for spine, for hip, for posture, for balance, so that you can get started on the right foot. For more information for that, you can check out my website. And as always, my workshop, Journey to Fracture Proof, puts all the educational information about exactly what you should do in one spot, easy to use resource that you can watch as many times as you need. Thanks for joining me.